Imagine greeting each morning with legs that feel powerful, steady, and alive with energy. Legs that carry you effortlessly through every dance, every stroll in the park, and every adventure you choose. No more struggling with weakness. No more sudden cramps that stop you in your tracks. No more silent fear of falling. It is possible, and it begins with the right nourishment. Today, we are unveiling the 7 most powerful vitamins and minerals that can transform your leg strength, boost your balance, and rekindle your confidence. These vital nutrients have the ability to fortify your muscles, protect your bones, and enhance circulation, helping you move freely, live independently, and enjoy every moment on your feet. If you cherish the joy of movement, whether it's a gentle walk, an afternoon dance, or simply the comfort of walking strong and tall, you're exactly where you need to be. I would love to hear where you're tuning in from today, so don't hesitate to leave a comment below. And if you're passionate about taking charge of your health, make sure to hit that subscribe button and turn on notifications. Together, let's build a future where every step you take is filled with strength, stability, and freedom. 1. Vitamin D. Vitamin D is the first nutrient we should discuss because, of course, our bodies alter as we get older. Deterioration causes a loss of bone density and muscle mass, which in turn makes it harder to do things that were formerly easy. Not only does it cause brittle bones, but a lack of vitamin D is one of the most ignored causes of this decline. The proper functioning, balance, and strength of the legs depend critically on this vitamin. Let's take a closer look at why vitamin D is crucial for older adults' leg strength and how getting enough of it can improve their mobility and general health. Getting enough vitamin D from sunlight gets harder for older skin. The situation is exacerbated since many elderly people avoid being outside as much as they used to because of changes in their lifestyle, inability to walk as easily, or fear of skin damage. What is the outcome? A systemic weakness that gradually weakens the muscles and makes the legs shaky. Muscle weakness and an increased risk of falls in the elderly are directly associated with low levels of vitamin D. According to repeated studies, vitamin D helps prevent accidents and fractures by strengthening muscle fibers, improving coordination, and enhancing balance. According to a study published in the Journal of Clinical Endocrinology and Metabolism, on the flip side, individuals suffering from a deficiency encountered a heightened rate of muscular atrophy, which rendered even the most fundamental tasks, such as ascending stairs or rising from a chair, more difficult. While proper calcium absorption and bone health are essential, vitamin D's benefits extend beyond those areas. This supervitamin boosts neuromuscular transmission and protein synthesis, 2 processes that have direct effects on muscle performance. Imagine it as a way to keep your leg muscles going strong. Without it, they have a hard time giving their best performance. Vitamin D is essential for the maintenance of fast-twitch muscle fibers, which are involved in balance and rapid reflexes. According to research, by enabling the legs to react quickly when balance is impaired, these fibers aid in the prevention of falls. A decrease in these muscle fibers' health, brought on by an inadequate vitamin D diet, increases the likelihood of injury, weakens muscular contractions, and slows reaction times. Many elderly people suffer from persistent leg pain and stiffness. However, research has shown that vitamin D can help by reducing inflammation in muscle tissues. Optimizing vitamin D levels can provide considerable comfort for those who have leg cramps, stiffness, or inexplicable pain on a regular basis. This may come as a surprise to some. Disregarding vitamin D insufficiency can lead to several severe health complications, not limited to weakened legs. The scariest include fractures and osteoporosis. Fragile bones are more likely to break if there isn't enough vitamin D in the body to absorb calcium. The ability to move around and be self-reliant could be severely impaired if even a small fall resulted in a broken bone. A lack of vitamin D is associated with impaired immunity, cognitive loss, and an increased risk of cardiovascular disease. In addition to skeletal and muscular problems, elderly people who don't get enough vitamin D may have weak legs and an increased risk of chronic diseases, both of which lower quality of life. Is there a way to fix this? Optimal vitamin D levels are simple to achieve and can have profound effects on one's health and well-being. If you want strong, stable legs and more vitamin D, here are the best ways to do it. Being out in the sun, you can get a natural boost by spending 15 to 30 minutes in direct sunlight, ideally in the morning or late afternoon. To get the most out of it, expose your arms and legs. However, use caution while applying sunscreen, since it inhibits the body's natural production of vitamin D. While it may not be possible to fulfill daily needs only through food, including fatty fish, mackerel, sardines, fortified dairy, egg yolks, and mushrooms can help. A vitamin D supplement is crucial for many elderly people, particularly those who do not spend much time outside. While higher dosages may be necessary for individuals with severe deficiencies under medical care, the majority of experts recommend 800 to 1,000 IU per day for optimal bone and muscular function. An easy blood test can clear up any confusion regarding vitamin D levels. Vitamin D deficiency is now commonly tested for in elderly patients because of the importance of this nutrient in reducing the risk of fractures and falls. 2. Vitamin B6. Most people don't realize how important vitamin B6, whose scientific name is pyridoxine, is for maintaining strong legs and healthy muscles. Although numerous nutrients aid in movement, vitamin B6 is particularly important for the proper functioning of nerves, the healing of muscles, and the efficient utilization of protein for the development and maintenance of muscular mass. Even the strongest muscles can atrophy without it, making even the simplest of motions like getting out of a chair or going upstairs feel like an uphill battle. The role that vitamin B6 plays in nerve communication and coordination is one of its lesser-known but crucial functions. A lack of B6 can cause these impulses to slow down or be misdirected, which can cause tingling, numbness, and even a shaky gait. A lack of nutrients necessary to sustain appropriate neuromuscular function is the underlying cause of these symptoms, which many elderly people mistake for aging-related muscle atrophy. Preventing inflammation-related muscular tiredness is another important role that vitamin B6 plays. Reduced muscle pain and maintained flexibility and resilience are benefits of vitamin B6, which aids in the regulation of the body's inflammatory responses. A possible game changer could be boosting your vitamin B6 consumption if you've been dealing with persistent stiffness or sluggish recovery after exertion. In addition to its role in skeletal muscle, vitamin B6 is essential for the synthesis of red blood cells. Muscles are fueled and maintained with the endurance required for prolonged activity by these cells' ability to carry oxygen throughout the body. If your hemoglobin levels are low due to a B6 deficiency, your muscles may not get enough oxygen, which can lead to early weariness, heavy feelings, and decreased stamina. Experiencing excessive fatigue, even after brief periods of modest activity, may be your body's method of requesting additional vitamin B6. How is this vital vitamin produced? B6 is fortunately abundant in many tasty and easily accessible foods. Great sources include chicken, fish, especially salmon and tuna, bananas, potatoes, chickpeas, and fortified grains. Your neurological function and muscle strength can be supported by naturally replenishing your B6 levels, which can be achieved by including these items in your daily meals. To attain optimal levels, B6 supplementation may be required for persons with gastrointestinal problems, impaired nutritional absorption, or food restrictions. Older persons usually require about 1.5 mg of vitamin B6 daily for women and 1.7 mg of vitamin B6 daily for men. However, this does vary by age and gender. While getting enough B6 from dietary sources is usually safe, long-term misuse of high-dose pills can cause nerve damage, so it's important to be careful. The most effective tactic is to prioritize a well-rounded diet that is abundant in B6 sources, guaranteeing a consistent supply without needless dangers. 3. Vitamin K. When thinking about essential nutrients for strong bones, Calcium and vitamin D usually dominate the conversation, yet without vitamin K, their benefits would fall short. Vitamin K plays a critical behind-the-scenes role, ensuring that calcium is deposited exactly where it is needed, in the bones, rather than accumulating in soft tissues or blood vessels, where it could lead to stiffness, poor circulation, and cardiovascular issues. By acting like a meticulous traffic director, vitamin K protects both bone strength and vascular health. This function becomes even more crucial with age. Numerous studies show that higher vitamin K intake is associated with improved bone density, a reduced risk of fractures, and overall skeletal resilience in older adults. It strengthens bones by activating osteocalcin, a specialized protein responsible for binding calcium firmly into the bone structure. But the importance of vitamin K extends beyond bones alone. Keeping joints supple and muscles coordinated also hinges partly on sufficient vitamin K levels, a connection often overlooked. Scientific research highlights that vitamin K supplementation can ease knee stiffness, commonly reported by seniors, and mitigate joint inflammation, potentially slowing the advance of conditions like osteoarthritis. If getting up from a chair or walking after long periods feels difficult, boosting your vitamin K intake might offer significant relief. Poor leg muscle strength, impaired balance, and a heightened risk of falls have all been linked to vitamin K deficiencies. This vitamin also helps regulate calcium within muscle cells, promoting smoother, more controlled muscle contractions and avoiding the jerky movements that often precede a fall. Vitamin K, found abundantly in leafy greens such as spinach, kale, Swiss chard, collard greens, and Brussels sprouts, is the form most prevalent in plant foods. Vitamin 2, meanwhile, is found in fermented foods like natto, aged cheeses, and select animal products like liver and egg yolks, prized for its superior bioavailability and its extended action within the body. Enhancing your vitamin K intake naturally can be as simple as incorporating a daily portion of leafy greens or fermented foods into your meals. For those facing digestive issues or taking antibiotics long-term, supplementation might be necessary to maintain healthy levels. However, it's important to proceed carefully. Vitamin K plays a pivotal role in blood clotting and can interact with anticoagulant medications such as warfarin. Consulting a healthcare professional before initiating supplementation is always recommended. 4. Magnesium. In the background, magnesium facilitates the smooth contraction and relaxation of your muscles with each stride you take. It supports endurance, reduces tiredness, and prevents spasms by acting as the master regulator of muscular activity. Leg cramps and restless leg syndrome are among the most prevalent yet underdiagnosed signs of magnesium insufficiency. Nighttime cramps, which affect a lot of elderly people, make it hard to get back to sleep and get up and about in the morning. This is more than simply an annoyance. It means your body is having trouble controlling how much you relax your muscles. Those who suffer from muscular tension or involuntary contractions must take magnesium because it helps calm hyperactive nerve signals and prevents muscles from unexpectedly stiffening up. However, muscles aren't magnesium's only function. Bone density and healthy joints also depend on it. When it comes to bone health, calcium is usually the star, but magnesium is essential for calcium to work properly. This mineral is important because it controls the transit of calcium, making sure it goes into bones instead of soft tissues, where it could cause pain and stiffness in the joints, an integral part of general mobility. Research has shown that older persons with increased magnesium intake have stronger bones and a lower incidence of fractures. Magnesium is quickly lost due to stress, medicine, and bad eating habits, which is a major reason why magnesium insufficiency is so prevalent. Diuretics, proton pump inhibitors, and several blood pressure medications are among the many treatments that reduce magnesium levels in the elderly. Magnesium deficiency, which stealthily erodes strength, endurance, and flexibility, is a common consequence of diets poor in magnesium-rich foods. This is why many elderly people notice a slow but steady decline in their stamina, resulting in shorter walks, slower stair climbing, and general exhaustion after even light exertion. Age isn't the only factor. Improper nutrition also plays a role in reducing performance. Magnesium replenishment has a rapid impact on leg health, alleviating cramps, boosting energy, and reestablishing a feeling of comfort in movement. Magnesium is best consumed through foods such as legumes, nuts, seeds, and leafy greens. Magnesium is an essential mineral for strong muscles and bones. Foods high in magnesium include avocados, almonds, pumpkin seeds, spinach, and black beans. Magnesium supplements, particularly the more easily absorbed magnesium citrate or magnesium glycinate, can be helpful for people who do not obtain enough magnesium from food alone. When magnesium levels are restored, a stunning shift takes place. When seniors get up and move around, their legs react with more vitality even though they were previously weak and heavy. Muscle cramp and stiffness sufferers report feeling better after using it, which in turn improves their sleep and mobility. The neuromuscular connections that control steady movement are regulated by magnesium, which improves balance and coordination. 5. Vitamin B12. Although protein and calcium are often celebrated as the champions of strong legs, few realize that vitamin B12 is just as crucial, perhaps even more so, for preserving strength, coordination, and mobility. This essential nutrient ensures the flawless operation of the nervous system, enabling precise and powerful communication between the brain, spinal cord, and the muscles that propel you forward. Without enough vitamin B12, the transmission of these vital electrical impulses begins to falter. Gradually, muscles lose their vigor, instability creeps in. Over time, simple movements that once required no thought, standing, walking, climbing stairs, may feel uncertain, labored, or even dangerous. Symptoms like heavy, weary legs, persistent tingling, or numbness often serve as early warnings of a B12 shortage. Yet, among older adults, this deficiency is remarkably widespread. The challenge stems from the body's dependence on adequate stomach acid and a protein called intrinsic factor to properly absorb B12. As we age, reduced stomach acid production, digestive disorders like gastritis, and chronic use of antacids further erode absorption efficiency. Combine these digestive hurdles with dietary patterns low in B12-rich foods, and it's easy to see how a gradual, often unnoticed, deficiency develops. Left unchecked, the consequences can be severe, irreversible nerve damage that sabotages balance, weakens reflexes, and undermines coordination. The silver lining? Restoring vitamin B12 levels can dramatically improve energy, strength, and functional mobility. Studies show that replenishing this nutrient in seniors who are deficient often leads to marked improvements in leg endurance, steadiness, and confidence during movement. Since plant foods offer virtually no B12, the best natural sources are animal-based, lean meats, shellfish, especially clams, dairy products, liver, and eggs. For those following vegetarian or vegan diets, or individuals struggling with absorption issues, fortified foods like plant-based milks and cereals, or B12 supplements, are essential lifelines. Importantly, vitamin B12 is considered very safe for supplementation, as excess amounts are excreted harmlessly in the urine. In cases of significant deficiency, higher dose oral supplements or periodic B12 injections may be recommended under medical supervision. Maintaining optimal B12 levels is about more than preventing fatigue or weakness. It's about preserving the intricate neural connections that power swift reactions, steady steps, and overall independence. Without strong nerve-muscle communication, even the best exercise routines or diets fall short. Recognizing the critical role of vitamin B12 is one of the smartest, most powerful strategies for aging with strength, resilience, and grace. 6. Calcium. Bone remodeling is still ongoing in younger people, but as they age, their bone mass gradually decreases, leaving them more prone to fractures. The legs are especially vulnerable to this. The most common and devastating types of injuries seen by the elderly include hip and femur fractures, as well as stress fractures of the lower extremities. When bones don't have enough calcium, even a little fall that wouldn't hurt when you're younger might cause months of healing time or even chronic mobility issues. However, calcium is essential for more than just strong bones. Muscle contraction also relies on it. The intricate relationship between calcium ions and muscle fibers are fundamental to every motion, from walking to getting up from a chair. Calcium ensures regulated movement by acting as a trigger for muscle contraction. Inadequate calcium intake can cause muscular cramps, weakness, or inability to produce the force necessary for stability. This is why a lack of calcium causes many people to have weak muscles, slow motion, and frequent cramping in their legs. Thus, how can one make sure their bodies are receiving adequate calcium? Milk, yogurt, and cheese are among the best sources, but they're far from the only ones. You can also get a lot of calcium in foods like sardines, almonds, bok choy, kale, leafy greens, tofu, and fortified plant-based milks. For optimal bone maintenance and constant absorption, it's best to include a variety of calcium-rich foods in your diet. Those who have trouble absorbing calcium or who have food limitations may find that the amount of calcium they get from food alone is insufficient. Supplemental calcium, especially when coupled with vitamin D, which increases the body's ability to absorb calcium, can be helpful in this regard. Nevertheless, there are cases where more isn't necessarily better. Although calcium is necessary, too much of it, especially in supplement form, can cause problems with the digestive system, kidney stones, and arterial deposits. The ideal daily intake of calcium for older persons is 1,000 to 1,200 mg, which can be obtained through a mix of natural foods and, if needed, supplements. In addition to consumption, physical activity is a critical component in the absorption of calcium. Walking, resistance training, and even mild running are all examples of weight-bearing workouts that promote bone remodeling and aid in directing calcium to the areas of the body that need it the most, the muscles and bones. No amount of calcium can fortify the bones and joints if you don't walk about. Calcium deficiency weakens more than just bones. It takes away people's freedom of movement, participation in things they enjoy, and autonomy. A life of independence, steadiness, and self-assurance starts with calcium-supported bones and muscles. Today, you have unlocked a powerful truth. The strength in your legs, the steadiness in your steps, and the freedom in your life are not just a matter of chance. They are the result of choices you can make, starting right now. Every nutrient we explored today, from the fortifying force of vitamin D and calcium, to the hidden neurological power of vitamin B12, the calming influence of magnesium, the energetic boost of potassium, the guiding wisdom of vitamin K, and the restorative support of vitamin B6, holds the key to building a future where movement is not a burden, but a joy. These vitamins and minerals are not distant dreams or unattainable luxuries. They are within your reach, woven into the foods you choose, the moments you spend under the sun, and the commitment you make to care for yourself with intention. Small daily actions, compounded over time, have the power to restore your strength, preserve your independence, and rekindle the vibrant energy that aging was never meant to take away. Imagine a life where standing tall feels natural, where walking across the park feels effortless, where stairs no longer intimidate you, and where your legs are not a source of fear, but of confidence. That life is possible, and it begins the moment you decide to nourish your body with the attention and respect it deserves. If today's video inspired you, even just a little, to believe in that possibility, I invite you to take the next step. Give this video a thumbs up, so we know these messages are reaching hearts that are ready to transform. Share your journey with us in the comments, your questions, your experiences, your victories, big or small, because your voice strengthens not just your path, but the entire community we are building together. And if you are committed to living not just longer, but stronger, healthier, and freer, then subscribe to our channel and turn on notifications. Each week, we will bring you new insights, new strategies, and new encouragement, all tailored to help you protect what matters most: your freedom, your vitality, your life. Thank you for choosing to spend your time with us today. Never underestimate the power you hold within you to shape your health, your strength, and your future. Until we meet again, stay strong, stay determined, and keep moving forward, one empowered step at a time.